Assalamu alaikum. Welcome to my channel Dr. Shami says. So from today onwards I am gonna start the rapid review of SK19 volume 1. So let's start from the Madison 20th August afternoon paper. Question number 1. After myocardial injury, what biochemical changes will be seen in the hypoxia, that is anaerobic glycolysis, and the glycogenesis? The patient after 1 year of the gastrectomy has the anemia, fatigue, and the raised MCV110. He is also having the peripheral numbness and the tingling sensation. Which type of anemia he is suffering from? The pernicious anemia. Child awake from sleep and the stairs starts walking. It is termed as the somnambulism. The woman had the polyp in the cervix. It was removed, and histopath shows the portion of the polyp covered by the squamous epithelium. The change is the metaplasia. The 29 female presents with the lethargy and irritability for the last 5 years. Labs revealed HP of 9 cmc was 70 and NCSE low, normal TLC and the platelet counts. She was prescribed iron supplements. Yet after 2 months, she had HP of 10.2. Which lab investigation should be ordered to find the underlying cause of the pernicious anemia? The HB electrophoresis decrease. Potassium excretion is due to the metabolic acidosis. After diabetes, cytokines involved in neutrophils migration is the C5a. The correct sequence of events for the neutrophil migration toward the site of the acute is that is the sequence is the margination, rolling, adhesion, and transmigration. Question 9. The hormones responsible for the glycolysis, gluconeogenesis, and the ketogenesis is the glucagon. Intrahepatic protein anabolism and extrahepatic catabolism is caused by the cortisol. 10-year-old boy diagnosed with the tapeworm infestation. The drug of choice would be the nicosamide. The least dilatable part of the urethra is the membranous part. Question number 13. The bone marrow biopsy is done by the ventral iliac crust. The which hormone used phospholipase C as a secondary messenger? That is the oxytocin. 15-year-old man with a long history of alcoholism presents with a severe epigastric pain, nausea, vomiting, fever, and the increase in the serum amylase. Diagnosis of the acute pancreatitis superimposed in the chronic pancreatitis was made in this condition. Which of the following types of necrosis is made most characteristic? Fat necrosis. Type of the flood due to the appendicitis is the exudate. Woman with the hyperthyroid feature is with a goiter, diagnosed with the iodine deficiency. The cause of the deficiency is the improper diet. The patient in the RTA sustained sacral injury. He presented with the overflow incontinence. What is the lesion? That is the parasympathetic. Next, the patient is having the bleeding problem. The app shows the PT of 14 seconds, APTT 60, which is prolonged. The bleeding time 6 minutes, and defect of which of the following pathway? That is the intrinsic pathway. Next, the nutritional assessment of the patient. We assess nutrition from his weight loss by the albumin and the TABC, muscle of the forced expiration, internal intercostal and the rectus abdominis. Increased disease, increased bleeding, what will be raised? That is the APTT, which with the exception of the sweat glands, parasympathetic system cause what? The promote the secretion. Paraneoplastic syndrome is caused by which of the following? The small cell carcinoma of the lung. The ECG of a girl UCS sawtooth wave with the P wave in a ratio of 3:1. Her pulse is regularly irregular. This is the following has occurred. That is the atrial flutter. The surgeon performing thyroidectomy during the upper lobe thyroid surgery. Nerve likely to damage in the proximity of the superior thyroid artery would be the external laryngeal nerve. The woman with the history of trauma to the head and neck, having the lesion on the tongue, on the protein of tongue, deviated the left side, the nerve most likely involved with the left hypoglossal. The patient suddenly developed the oliguria. Even after 3 dialysis in session, patient failed to have the urine output. Creatinine is still amplified. Biopsy shows the cortical necrosis and the severe acute tubular necrosis. What is the cause in this patient? That is irreversible injury. 55-year-old male with a past history of gastric pain for which he was taking antacids were diagnosed with the gastric lymphoma. What is the most likely cause? That is the H. pylori. The young lady has the gallstones which has caused blockage of the bile duct. This will lead to the increased fat contents of the stool. In hiatal hernia repair, which structure is at the risk of the rama? The vagus nerve. The congenital lower motor neuron of the facial nerve is common because of the birth defect. Old man with a generalized body edema, cause is the hypoproteinemia. A lady cut her finger by knife while working in the kitchen, which by which mechanism the vasomotor response increases? That is the postganglionic C fibers. The patient presented with the bilateral ptosis with the muscle wasting on the mastication, decreased voice until no voice, utter, diagnosed as myasthenia gravis. The best test for it must be the EMG. Next, the right lung has the bronchogenic carcinoma, middle lobe removed surgically. Segments include the medial and the lateral. The child had the recurrent infection, and every time Klebsiella is found. What is the diagnosis? CJD. Fanconi syndrome, a rare genetic disorder. The child with the decreased ATP will present with the glycosuria. The site of murmur for the aortic regurgitation, right second intercostal space. Lady had a difficult labor at the home in the village. She was brought to the hospital. The history of the Persian bleed oozing from the gums for the last 10 hours. Her CBC shows the 6 grams per deciliter platelets of 30,000, TLC of 24,000 with the neutrophilia. The peripheral blood film shows blood cells. Her PT and APT were prolonged. Most likely the cause would be the DIC. The person got stabbed on the upper arm and the floor of the axilla. Which of the following structure will be damaged? That is the intercostobranchial artery. The person after trauma, all the muscle of abdomen and chest paralyzed, still breathing, which level injury? That is the below C5. The early adolescence with the prominent forehead, everted looking ears and the long longitudinal mandible in the hypogonadism is clinically diagnostic of the Fragile X syndrome. Histology shows the flask shaped cells, multiple dendritic synapses in the cerebellar cortex. H2 receptor blocker is not of therapeutic value in which condition? That is a Zollinger-Ellison syndrome. Next, the urinary abnormality associated with the schistosoma hematobium, the glial fibrillary acid protein positive in the astrocytoma. The patient presented with the severe metabolic alkalosis. BP was 150 by 90, sodium 150 and the potassium 3. There is increased aldosterone level in his blood. That is primary hyperaldosteronism. 38-week pregnant woman visited her family in a remote area, after which she developed jaundice suddenly. Which type of the hepatitis most likely prevalent in the pregnant woman? That is the hepatitis C. Which of the following virus is most dangerous in case of the pregnant lady? That is the hepatitis C. 45-year-old previously normal lady start having the dyspnea, dry cough fever for 3 months back, recovered for 1 month when she went on the vacation, again developed the symptoms when she got back to her Canaries X-ray, multiple nodular lesion in all lung zones. The mechanism of the development of the symptoms was due to the antigen antibody mediated reactions, the increasantry glomerulonephritis antibody complex deposition on GBM. Which type of hypersensitivity? That is the type 2. Posteriorly inferior limit of the lung, which we call the posterior inferior lobe, is at the level of the 10th rib. In asthma, which one increases? FRC. Which factor sees an increase in the restrictive lung disease FEV ratio FVC? Regarding REM sleep, true is the beta waves. The watchman presented with the high grade fever. Hemoptysis, a factor molecule, is the toll receptor in normally functioning myocardium. C wave coincide with the closure of the AV valve. The farmer's lung is due to which of the following agent? That is the grain dust. The hemoglobin begins to appear at which stage? That is the intermediate normoblast. Which one is the primary lymphoid organ? That is the thymus. The group of mice was taken. Injection of the plastic hydrocarbon was given. This will work as initiator in the process. The initiator work as a permanent DNA damage. The inhibitor given the patient. What will happen? The decrease angiotensin 2 and the bradykinin. Neck veins normally don't distend. They distend when the right atrial pressure rises above the 8. Next, in homeostasis, the word gain is for the exaggeration of the negative feedback. The person with the difficulty in the swelling, there was some white growth inside esophagus with the pseudohyphae. Likely reason is the candidiasis. The 50-year-old presented with the HP of 8.2 large spleen, TLC raised peripheral smear showing the mature myeloid lineage. What is the genetic defect? The 9:22. Which bacteria has no cell wall? The mycoplasma. The female had the aortic root dilatation up to 4 cm. Ocular examination shows a less dislocation mitral wall leaflet defect with the systolic click defect. In which of the following there is inherited deficiency of the fibrillin? The patient after RTA having the fluent nonsense speech is due to the damage of the Wernicke areas. The fracture of head of femur led to the vascular necrosis of the head artery involved is which of the following? That is the medial circumflex artery. Next, 72 while doing splenic surgery. While doing surgery, the splenic vessel need to be ligated. They are present in which ligament? That is the lienorenal. The patient with the tip of the tongue carcinoma, first drainage would be to the submental. The lymphocytes normal percentage in the blood is the T lymphocytes 80 to 90%. Sensitive preganglionic sympathetic fibers travel through the white thramus. The mother has a child of 10 years diagnosed with the meningitis, and now she asked that another two child 4 and 6-year-old are at the risk of meningitis. How will you tell the route of the spread of the infection? Respiratory droplets. Which one of the following represents the pressure difference that acts to distend the lungs? That is the transpulmonary pressure. A man during a roadside accident suffer injury to the cervical sympathetic chain, most likely change in the eyes, the ipsilateral pupil constriction. The ligament impairs at the last during epidural is the ligamentum flavum. The neoplasia has the parenchyma and the microenvironment. Microenvironment has the stroma plus inflammatory cells. Next, question number 86. The after gunshot bullet enter about mandibular sternal joint and the exit T4. Which part will be the least affected? That is esophagus. During hip surgery, vessel to the head of the femur ligated. Which artery is the main source of this vessel? That is the femoral. Transient adhesion of the white blood cell to the endothelium is the selectin. The patient having the travelers diarrhea not responding to antidiarrheal drug. Which drug should be given in this case? That is the norfloxacin. Niacin deficiency causes which of the following fact? The CNS defects. Which hormone responsible for increased gastric emptying? That is the gastrin. Patient has aphasia and the upper arm weakness. Thrombosis involved. Which of the following artery? Middle cerebral artery. The part of the sperm containing the proteolytic enzymes to digest the zona pellucida is the acrosome. In which brain part neural activity increase before skills movement? That is the cortisol association area. The patient presented with the Crohn's disease. For her treatment of the remission, corticosteroids are given. What is the best for the maintenance of the remission of heart disease? Azathioprine. The lady presents after a trauma in the life. On examination, loss of the dorsal sensation of the left foot with the loss of dorsiflexion, the loss of eversion at the talotarsal joint. Which of the following nerve is damaged? The common peroneal nerve. Lamella forming the minimum air blood barrier is the pores of Cohen's. The person running the marathon race, blood flow to the non-exercising muscle is by the sympathetic cholinergic. The woman with the 5 weeks of pregnancy contracted the German measles. She consulted her obstetricians worrying about the baby, which is the most likely complication the baby might develop. That is the congenital cataract. The 100G protein phospholipase see increased intracellular concentration of the calcium ions. Increased potassium levels can cause which of the following? The flaccidity. Next, 1 or 2, the adult polycystic kidney disease. The mode of transmission would be the autosomal dominant. Normal distribution curve. The mean equals median equals mod. The side effect of the decumarole is delayed clotting. 105 massive blood transfusion leads to the hypocalcemia. The patient with the EDT heat loss is by the evaporation. The vein accompanying the left anterior descending artery is which of the following? There is the great cardiac vein. Duct distributed through the aqueous distribution is the digoxin apex of heart. Blood supplied by the anterior interventricular artery. 110. The primary villus consists of which cells? The cytotrophoblast and the syncytial trophoblast. What does the PR interval shows? That is the SN node conduction to the ventricles. Atria stretch leading to the tachycardia. This is the brain bridge reflux. S1 and S2 hearts sounds. The former has more duration. The cause of atherosclerosis usually is the endothelial injury. Nerve compression between the C5 and C6 compress. Which of the following? That is the C6. Which factor should be the most important in the descriptive studies? That is the sex. The antidote for the opium is the naloxone. The intrinsic pathway is activated by which factor? 11. The treatment of the severe thalassemia major is by the regular blood transfusion schedule. Zollinger-Ellison syndrome associated with which of these? That is the peptic ulcer disease. The polysynaptic synapses is related to the cremasteric reflux. The patient diagnosed with arterial fibrillation. How will you manage the patient if he is hemodynamically unstable? That is the cardioversion. What does the bacteria secrete which help in the proliferation of the new capillaries in the wound? PDGF. A patient has the complex partial seizure. How will you treat this patient? That is the carbimazepine plus primidone. The patient developed the sudden weakness, the right upper and the lower limbs and the mouth developed to the left. Which artery is involved? MCA. The common tumor suppressor gene is P53. The hormone that increase bicarbonate secretion from the pancreas is the secretin. The 9-month-old girl was vaccinated 2 weeks back. Now presence threshold of the body, fever, and the CBC report showing HP of 13.5, TLC of 6, and the decreased platelets. Peripheral smear shows the large platelets. What is the diagnosis? That is ITP. Thigh adducted medially rotated and flexed by the sartorius. Diagnosis of the colon, CA, made many years back. CA was raised. That time the patient came for the regular checkup. You advise CA now. What is the role of CA? The follow-up. The patient is taking oral anticoagulant. Which factor is used to monitor the effect? That is the PT. For heparin it is APTT, and for warfarin it is INR. The patient has the weakness, pallor, dysphagia, and the fatigue. HP of 6. Peripheral smear shows microcytic hypochromic cell. Suitable diagnosis would be the iron deficiency anemia. Minimal change disease feature is the proteinuria 3.5 gram. 35-year-old female presents with the 6 months history of the fingers turning pale in the cold. The Raynaud's phenomena, also having the mild dyspnea with no V's, which with mildly large spleen. Creatinine was high, urea was raised, ANA positive, HB10, TLC, and the platelets normal. Which antibody will be raised? That is the anti-centromere. 60-year-old patient presented with a high-grade fever, headache, and the Kernig sign positive on LP. Excess of glucose were 14, the neutrophils were raised. Which drug should be given? That is the ceftriaxone. 45-year-old female present the bone pain, the pathology of the lower limbs. A laboratory investigation were done and showed serum calcium level 2.60, inorganic phosphate 0.9. LP385, PTH levels were borderline. What is the diagnosis? That is the primary hyperparathyroidism. The 20-year-old lady, old boy with rheumatic valvular heart disease has been running a low-grade fever for the last 2 weeks. In addition, pancystic murmur is found to have splenomegaly, and the clubbing. The treatment should be the injection penicillin with the gentamicin. Main objective for the screening test for the tumor is early diagnosis of the tumor. The main function of the hepatocytes is the metabolism of the drugs. Antibodies in the Hashimoto's thyroiditis is the anti-thyroglobulin and anti-microsomal. 35-year-old female having the malnutrition, the positive anti-DS DNA now develops proteinuria as hematuria. The most likely cause will be the lupus nephritis. The pregnant lady having the hyperemesis gravidarum, which acid-base balance will be present. Metabolic alkalosis. The female patient present the hirsutism of obesity in the buffalo hump. She is diagnosed with the Cushing syndrome. Part of the feature will be present. There is a hypoglycemia. Patient on the warfarin therapy, which of the following drug dose should be adjusted? That is the cimetidine. The patient started warfarin have the TK and ecchymosis due to the deficiency of the protein C deficiency. 8 weeks pregnancy with affective disorder. Drug given should be the escitalopram. The hormone exhibit relation between the weight and the puberty is the leptin. The fats transport from the intestine as the chylomicrons. The female present the pain in the hands and joints with the morning stiffness, most likely suffering from the rheumatoid arthritis. The female lady presented the complaint of the fingers turning red, white, and the blue on the cold exposure. This is due to the primary knots phenomena. Home-based pregnancy test is the HCG. The patient is having the mitral valve disease. Now present the fever, malaise, and petechia. On examination, he is also having the splenomegaly. Splenomegaly, what is the causative agent of the such illness? That is Streptococcus viridans. Tricyclic antidepressants prescribed to the patient. Analgesics effect of TCA is seen after 1 week. 55-year-old lady with the mild hypertension wants the lifestyle modification. Advice shall be the walk 1 mile daily 4 days per week. The young boy had the fracture while playing the football. Later present the swelling on the anterior thigh. Biopsy shows a bony trabecular mass containing the hemorrhage. This is the most likely due to the metaplasia of the lymphoid tissue with the eosinophilic cortex and the basophilic medulla is the thymus. Tricep muscle is supplied by the radial nerve. The patient of HIV presented with some purple rash on the forearm. The cause would be the HHV8. The patient with the localized circumferential lateral valve infarct. Which artery is involved? That is LCX. The 25-year-old patient having the depigmented skin lesion in the back lips and the cheeks. There is family history of the diabetes. What is suitable pathogenesis of this disease? That is autoimmune. The patient with the dilated ventricles and having defect in the CSF absorption due to the defect of the arachnoid granulations. Next one, 63, the axillary artery is formed by the basilic vein and the vena committens of the brachial artery. The residual volume always remain the lung due to as it decreases alveolar collapse. Mifepristone given the terminate the pregnancy. It is the antiprogestin. The baby delivers at 32 weeks now having the respiratory distress for lung maturity. What drugs could have been given the mother antenatally? That is the beta metazone. Movement of the brain with the skull limited by the falx cerebri. Toxoplasmosis caused by the parasite, which is epidemic disease. 90% in the France, 50% in the US. In the latent toxoplasmosis is latent AIDS now mostly present with which condition? That is encephalitis. The patient has the cough and X-ray shows hilar lymphadenopathy, non-cagating granuloma. The effective cells would be the T lymphocytes. Patient has asthma for the 6 months. Cells involved would be the basophils. Tonsillectomy. Which structure should be preserved to prevent the hypoparathyroidism? That is the inferior thyroid artery. The patient went to dental clinic for the dental procedure. He was known case of the MI suddenly collapse series brain done shows thrombosis involved which artery? There is a middle cerebral artery. An old age shepherd having lesion on the forehead involved 2-3 basal layers with acanthosis and the atypia. What is the likely diagnosis? The solar keratosis. The noise induced cause damage to the outer hair cells. Next, 175, the old age patient with a generalized edema having the increased translucency of the lungs in the upper fields, flattening diaphragm, no evidence of the infiltration, no history of fever prominent both arteries prominent right border of heart on the radiograph. What is the most likely mechanism involved in the pulmonary arteries organizing atherosclerosis? Which pulmonary edema mostly happened in the basal lobe of the lung? There is a decreased arterial participation of oxygen. The drug given for the chronic use needs close monitoring because the low therapeutic index, which is the following, is the H2 blocker. That is the cimetidine. Women with a long-standing asthma and depressive disorder, most likely immunological change is the increased lymphocytic proliferative response to the mitogens. The EDV depends on the venous return. After RTA, the 1.5 liters of blood is lost. The degree in GFR union for which part of the nephron will bring back GFR to the normal, that is the DCT. The loudness is determined by the part of the basilar membrane deflection interacting when a hernia occurs due to the defect in the conjoint and bilateral damage to the hippocampus will result in the loss of ability to encode events of recent parts in the long-term memory. The facial pain, hyperacusis ganglion involved with the geniculate ganglion, which cells will remain dormant in the female up to age of 40. The primary oocyte, the lipid bilayer of the cell membrane having the cholesterol in structure. Function of this cholesterol in the membrane is permits the ion movements. 188, the hyper excitability of the neuron due to the deficiency of which of the following in the ECF, that is the calcium. Next, 189, the scalp layer related to the infection / pus would be the loose alveolar tissue in left circumflex blocked. Which heart part is involved? The left ventricle posterior. Patient with a multiple jar draining abscesses. What will be this in the microscopy? That is the granuloma with abscess. Last, the stored blood has the acidemia. Thanks for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.